In a miraculous case, a specialized team of neonatologists from Motherhood Hospital, Bengaluru carried out a novel technique, total body cooling procedure to save the life of a newborn baby today, who suffered a serious disturbance in the heart rhythm called neonatal supra'ventricular tachycardia. That makes the heartbeat abnormally fast. The NICU team at Motherhood Hospital, Bengaluru received an emergency call from Dr. Srinivas from Hrudaya Hospital in Anantapur, where a newborn baby girl was diagnosed with supra'ventricular tachycardia and was admitted in a critical state. Commenting on the efforts of the doctors, Mr. Vijayarathna Venkatraman, CEO at Motherhood Hospitals, said the entire team at Motherhood is committed towards providing timely medical access to patients irrespective of any geographical barriers, even if it entails going out of our way to provide the necessary service. Our patients' health is our topmost priority, and we are proud of the fact that our team of expert clinicians and support staff were able to save the life of this child with their expertise. Speaking about the NICU program, Dr. Pal Avgupta, head of medical operations, Motherhood Hospitals, Bengaluru, said, the neonatology program in Motherhood is the largest in the region. We have successfully treated more than 14,000 newborn and prematurely born babies. 40% of these babies are retrieved from remote areas of Karnataka through our neonatal transport NICU on wheels. Our integrated neonatology team gives the best care to babies who require NICU support. Dr. Prathap Chandra added, it was one of the most challenging cases and our only priority was to save the baby's life. Since SVT is a condition which disrupts blood flow to vital organs, cooling helped to reduce the basal metabolic rate, thereby reducing her heart rate. The baby is now almost 4 months old and has been regularly visiting for checkups and has recovered well. Expressing his joy, the baby's grandfather, Mr. Maraswamy Naik, said, my family and I are eternally grateful to the entire team at Motherhood Hospitals for treating my granddaughter and giving her a new lease of life. We had lost hope completely and were devastated to see her in that condition. Upon bringing her to Bengaluru, the doctors went out of their way to save the baby.
The baby was born in RDT Hospital in Anantapur, and the reason for delivering this baby was because they thought the baby's heart was racing very high. And when the baby was delivered, they also noticed that the heart rate of the baby was around 250 to 280. Because if your heart is beating that fast for a longer period of time, then your heart tends to fail. So this baby was referred to Hrudaya Hospital in Anantapur from RDT Hospital for a better care. And there they tried to give a dose of adenosine. This is a lifesaver drug and a drug of choice to treat babies who've got very high heart rate, especially a condition which is called SVT, which is supra'ventricular tachycardia.
Usually SVT in newborns are very rare. It's a very rare. Congenital SVT is very rare. We get it SVT, but some electrolyte imbalances and some conduction defects or some sepsis can cause SVT. But even that is very rare. I think I have seen 2-3 cases of SVT in newborns. Okay, pediatric we see some cases. And the line of treatment is adenosine, and which is given at RDT that come to Hrudaya Hospital for the further treatment.
So after giving the drug, usually the heart rate will come back to normal. However, it did not happen in our baby's case.
But the heart rate is already too high, and already injection adenosine was given. So the next line of treatment is very complicated. That needs some cardiac monitoring and cardiologist opinions, all this, which is not possible at Anantapur. So we shifted the child to Motherhood Hospital.
Our ambulance set off within 15 to 20 minutes after receiving the phone call. The baby was met at Chikbalapur, which is almost like halfway through from Bengaluru to Anantapur. And instead of just bringing the baby to the hospital straight away, we parked our ambulance in a safe place and then started giving adenosine medications under control. In spite of giving 3 doses of adenosine, the baby did not respond. So in spite of doing this, the baby's heart rate did not come back to normal. Therefore, the baby was put on oxygen and then safely transferred back to the hospital, where we have more resources in terms of looking after the baby. We are so confident with our ambulance transfers, and we call that as NICU on the wheels, because we can do majority of the things that can be done in the NICU itself. We started establishing this condition.
రోజు మాకి పొద్దున 10 గంటలకి కౌన్సిలింగ్ చేసేవాడు సార్, మీ బేబీ కండిషన్ ఎట్లుంది అని. మా సారు బాగా చేసి 3 రాష్ట్రాల వాళ్ళు వేరే దేశం వాళ్ళు కూడా పిలిచి మీ బేబీకి ట్రీట్మెంట్ చేపిస్తున్నానయ్యా.
We made sure the echocardiography is done immediately and made sure the structure of the heart is all right, and then we did a lot of continuous ECG monitoring to understand the type of rhythm that we're dealing with, to make sure our diagnosis of SVT is actually the correct diagnosis. Involved the cardiologist and the cardiothoracic team and discussed quite a lot about the case.
So this is when there is a baby where you've tried a lot of medical treatment, you've tried giving shock to the baby, and heart is not functioning well. This is when we had to go out of the box and then think about a novel therapy which can be used in order to save the baby. So this is when we administered a therapy called total body cooling, where the baby's temperature is brought down to about 33.5 degrees in order to make sure that the heart rate comes down. So by God's grace, it did happen. 4 to 6 hours after starting the treatment, the heart rate started getting better, and all the rhythm came back to normal rhythm. And we had to maintain this for some more time and make sure that the heart goes back to normal function. Then we started rewarming this baby very, very slowly, because if you're starting to rewarm, sometimes the rhythm will come back to the SVT. So luckily that did not happen. And then once we stopped the therapy, the baby's heart was functioning normally, and it had a normal heart rate of about 130 to 140, and then the rhythm of the heart was also normal. And then the baby was maintained on 3 medications for a period of about 1 month, sent back to where it came back from, and had a connection with the doctors there, continued the medical treatment in Anantapur, that's where the baby came from, and then made sure after 1 month we stopped all the medications. So we reviewed the baby after about 6 weeks. We repeated the ultrasound scan of the heart, and we were very, very happy to say that the heart was functioning normally, and then the rhythm was also normal. And this baby girl was a bundle of joy to actually look at.